research on menopause. Dr. Claus Runge, Senior Vice President, the Global Head of Public Affairs, Sustainability, and Internal Engagement, and the Chief Health Equity Officer for Bayer, and moderator Dr. Mayesha for a conversation about why menopause matters.
Hi, everybody. Thank you for sticking with us. I am incredibly excited to have this conversation on Menopause Matters with this group of panelists who are really the trailblazers and pioneers when it comes to an issue that is all too often overlooked on the global health agenda, on the global finance agenda, and even on gender equality issues around the world. And we at FP Analytics have been incredibly fortunate to partner with Bayer to lift the veil on menopause and to really shine a spotlight through rigorous research. And so today we're launching a new report on the health and economic impacts of menopause. It's an in-depth study comprised of a global landscape analysis and detailed case studies on the US, Canada, Germany, and the United Kingdom. And I encourage everybody in the room as well as online to use the QR code or the links on your screens to take a look at that report. And many of the themes we touch on in the research we'll have an opportunity to speak about today. So thank you again to all of you for joining us for this conversation, contributing to the research, and being committed to this issue. I'd love to start with a simple fact, which is that women's experiences of menopause are shaped by a range of socioeconomic determinants, varying from one person to another, from one context to another. And yet, one aspect of menopause, which is virtually universal, is that it remains largely invisibilized, both in terms of what that means for a person experiencing it, but also when it comes to healthcare policies, budgets, treatment options, and just public discourse. And so let me ask you, Claus, I'd love to start with you and then Jennifer bring you into the conversation on this, which is how can we, and by we I mean policymakers, employers, the media, civil society, how can we collectively better humanize women's experiences of menopause and raise awareness to both demystify and destigmatize what is a universal experience?
Well, thank you for the question. As a male panelist, I feel I have to earn my seat first. So I'm 50 years of age. My wife is in kind of the same age span as I am. I won't disclose details. But she's going through menopause for roughly 2 years now. And I can tell you it's very burdensome on the individual levels. So her night awakenings are mine. Her depressions are ours. And it's really something that can really weigh heavy on their day-to-day work, on their day-to-day life. Yeah? So that's something I wanted to start with. On a professional side, I've worked on menopause topics already like 20 years ago when I looked into the socioeconomics of menopause. And before we go into details of these, I can tell you so little has happened since then. We see little progress here and there in terms of research, but there is so much stigma around this period in a woman's life, which is not a disease, it's a transition, that I think we all should figure out how to do things better in the next 2 decades to come. We have 1 billion women worldwide who have gone through menopause and who are now post-menopause. And we know little effects about the long-term implications of what happens physiologically to the female body in that time. So I think it's a call to action that we all need to spell out. If you look into the workforce, the age group of women affected by menopause symptoms is rapidly growing. So roughly 10% of the workforce in industry nations is actually in that period of life. They have severe issues on delivering their day-to-day tasks when they experience symptoms. We talked to them in the pre-discussion. So also economically, it would be wise for countries to partner up with the private sector, but also with physicians who often know way too little about the disease, or not the disease, sorry, about the constitution, the transition, that it's really time to change the situation for women in need.
Yeah, there's a lot I want to unpack that you mentioned, but Jennifer, let me bring you in at this point, because I know at MenoGlobal you are very much dedicated to this issue of destigmatizing, demystifying, and helping people understand what the reality is of menopause.
Thank you very much. I mean, I think that we should actually pause here for a moment. I could come out with tremendous amount of data, or I could give you a single data point, which is, I believe this is the first ever menopause panel at the World Health Assembly. So I think that's pretty amazing. But it's also unfortunately very telling, as Claus was saying, you know, we have not seen action on this issue. This is an issue that has been around forever, since the dawn of time, most likely. I'm sure Pauline could perhaps correct me on the clinical front on that. But it has been virtually invisible on the global stage, in economies, in communities, and even among friends. I was early menopausal at 40. It happened to me when my mother was dying of breast cancer. She died a horrible death. And I started sweating, and I had no idea what was happening to me. And I went to the doctor, and the doctor said, "You have menopause. Go on the pill for the next 10 years until you should have had menopause." But I was terrified of breast cancer. And I also didn't feel comfortable discussing it. And my symptoms were brutal for many, many, many years. And so we now have to think about my situation and multiply it by thousands, millions of women. And some will breeze through. Some will have menopause and they will be empowered because they are no longer perhaps reproducing. Maybe they get to go to the mosque or the church or whatever the case may be for the first time for a wedding because they're not menstruating anymore. So for some women, it is liberating, it is empowering. For other women, it can be debilitating. And they are often misinformed, underinformed. They are perhaps living in silence. They may not even be discussing it with friends or family. It's truly something that only arises for you when it slaps you in the face, when it happens to you. And I've spoken to hundreds, perhaps even thousands of women across the globe who are experiencing the same thing. So the starting point for us is this lifting the veil. And every time we have a conversation, we are doing that. And so I think we are shifting the dialogue very slowly, but we are on that momentous journey now.
I appreciate both of you setting the scene with both, with such personal perspectives, but also very pragmatically. And I'd love to shift the conversation, having, addressed that question to what can we do about it? And Pauline, I'd love to bring you into the discussion. And, you are at the helm of both clinical work, but also research and advocacy and networking and really moving the needle in many ways. And so help us understand, how can menopause be better integrated into both primary health and specialized care? And how can medical training be improved to better equip frontline health workers to support menopausal and postmenopausal women?
Thank you, and thanks for the question, and how wonderful to be here at FP talking about menopause. I thought the height of it was Davos last year, and it just keeps going and going, which is a long way from the time I was in the back halls studying menopause at the NIH. So it's really important to make the case for care. So you have to motivate health systems to care. And here's where the data from McKinsey and the World Economic Forum comes in. They quantified that the annual GDP lost to menopause is $120 billion a year. Now, that's a lot of money to be recouped. So then the question is, what are the solutions? How do we get that care into primary care. So at the International Menopause Society, we have a solution. We have 15,000 people from 127 different countries who are registered for our IMPART training. This is a virtual training that's available across the globe. We need to scale those solutions. And as Dr. Kumar from the WHO mentioned earlier, there's a science to training. There are better ways of imparting menopause training, new tools of the science of how we learn and how we need to relearn, because we forget after we learn. So that's critically important. Another theme that emerged from earlier today is oftentimes the solutions have to be self-guided. I need to be able to diagnose myself with the proper evidence-based tools and then have those tools available to help me. It's really important to reach people not only in higher income countries, but also lower and middle income countries, which might seem like a high burden, but there are evidence-based approaches to delivering care through your cell phone. There are behavioral interventions that help with sleep, that help with hot flashes, that help with mood. And then you have to make the case for why you want to provide care for the woman. So we heard from Jennifer and from Claus these personal stories. But I think we also need to demystify, building on how Salinger started out today. How do we myth bust about menopause? Is it benign? How many years do you think women experience hot flashes? Any guesses? 7.4 years on average. How about if you're black? 10 years on average. That means 50% of black women experience hot flashes for more than 10 years. In our research studies, when we put hot flash monitors on women and measure them objectively, black women in the south side of Chicago had on average, any guesses? How many hot flashes per day? 27. How often do we wake up at night when we have a hot flash? 75% of the time. So let's put all of that together. Night after night, week after week, month after month, year after year, these women have hot flashes that aren't being treated. So is it surprising that the economic argument is $120 billion per year, especially in light of how women comprise the workforce? So a lot of it's education, dissemination of better evidence-based treatments, and training our providers in a way that recognizes how busy they are and how we learn.
Thank you for that. I mean, those statistics are incredibly illustrative of the scope of the problem. And with respect to the economic impacts, you know, our research specifically into the US, Canada, UK, and Germany shows similar trends in terms of the costs of inaction, but also the multifold returns on investment, both quantifiable and not. And I think one of the things that's really important to recognize is virtually everywhere in the world now, there's an understanding that for economies to grow, women have to be part of the workforce and to be able to fully participate. Well, you can't achieve that goal unless and until you're supporting menopausal women in the workplace to be productive and to do the best they can. And so it's not just about the healthcare sector getting, you know, to the table and waking up, but it's really about ministries of finance, private sector employers, and so forth. I want to talk a little bit about the specific approaches to care and treatments when it comes to menopause. And, you know, Claus, I'd love to come back to you and ask you a little bit about what are some of the innovative approaches that have shown promise in terms of improving women's quality of life, and how can treatment options enable personal choice so that it's not mandated by any one public health provider or insurer, and so that women can be making informed choices about how they receive the care that they need?
Yeah, thank you. Before I come to answering that question, I would just like to add a few thoughts and again, a personal example on how also encounters with OBGYNs sometimes happen. I remember being at a large sexual and reproductive health congress in Thailand a couple of years ago. And I met, I won't disclose the name nor the country, but I met the head of the medical association, OBGYN medical association of that respective country in Southeast Asia. And I said, look, we are working on some menopause solutions. We have a new asset in our pipeline that we're developing. And he said, like, we don't need it. Yeah? So When our women get a hot flash, they just take a cold shower. They love it. They love the cold shower. Everything's fine. And I think that's something to start with. I mean, if you have all the burden that's just been described, and you meet a professional seeking for help, and then the obvious reaction is ignorance at its best. I think that's something to really tackle. So we need to get into the curricula of those people being exposed to women and to train them and to make them receptive to the topic. So secondly, the second part I would just like to refer to is I did some willingness to pay research 20 years ago on menopause solutions. And what you see is that the women have a pretty high willingness to pay for solutions, which is reflective of the individual burden of disease. But if you then talk to healthcare decision makers, the willingness to pay really drops. And the difference between the individual and the healthcare system is probably one of the biggest across other different interventions in the healthcare system. That's also telling. So it's not just the individual physician, oftentimes, not all the time, oftentimes, it's also the system that has little respect, I would say, to include this in services that need to be rendered to women. Now, the final part is, and that's where the industry comes in. I work for a pharmaceutical company that has decades of experience in women's health, mostly contraception. But of course, we have now been able to develop a new product, which hopefully will be available to women worldwide soon. There's another manufacturer with a similar approach that perhaps some women in need, especially those who don't have an indication for hormone therapy, hormone replacement therapy, have a new option at hand. So, and that's something where we engage physicians on, and that may also help tell the story, spread the news, but also help people rethink how they treat women in this period of their lives.
Thank you for that. And it's in many ways, we've talked about the raising awareness, we've talked about the treatment options, but when it comes to making change and lasting change, what's also really important is policy and research, which are two of my favorite topics. And I'd love to bring all of you, all three of you, into the discussion on this. You know, it's really interesting when you look at national health strategies for countries that have a national health strategy, which is obviously not all, and plenty of countries where health strategies that are at a provincial or state or some other level, very, very, very few mention menopause at all. And similarly, if you look at economic growth strategies and so forth, very few mention menopause at all. So there's really something missing when it comes to the policy piece. And the other kind of side of that coin is the research, the evidence, the data, something that both of you, all three of you actually touched on. And so I'd love to ask you, from your vantage points, what are the most critical research gaps that need to be filled at this stage in order to change the tide on menopause? And what are the most important policy actions that need to be taken? So maybe Jennifer, we'll start with you, Pauline, and then Claus.
Sure, thank you. I mean, my focus very much on low and middle income countries, and I think what was shocking to me to learn is that our global surveys and many of our national surveys on demographic health only go up to age 49. And then perhaps we have aging surveys in some countries, but what that means is we have no continuous data. And not only do we have no continuous data, but we often are asking only a single binary question. Have you menstruated in the last 6 months? So it's very difficult to imagine how are policymakers supposed to be making policy in the dark? Because I think of menopause as a black box full of compartments. We talked a little bit about social determinants, but social determinants matter enormously. Economics, culture, religion, family, all of these things don't just qualitatively influence a woman's experience. We know from small studies that they actually influence levels of symptoms. Stress impacts age of onset. But currently, what we don't count doesn't count. And what we don't count is we don't have a picture of women's health from the age of onset. We don't have a picture of their symptoms. We have no dedicated modules for menopause. And even when we do discuss it, the women don't have the terminology to even know. So if women don't know what is happening to their bodies, they're not going to be able to report symptoms. And what's critically important about that is there also is no care-seeking behavior. So I think what's important to recognize, and I can talk a little bit more about policy, but I think the way we see it at MenoGlobal is every woman, as a baseline, deserves to know what is happening to her body, and then have the right to decide what to do about it. And the rights come from policy. But right now, we have no demand-seeking behavior. There is no demand in many countries because they don't know what is happening to them or they don't know what is coming. And they can't associate their symptoms with the potential long-term health span and longevity issues that could follow.
Thank you.
Thank you.
So we in the United States have been working at a policy level, both on the Hill and on a state-by-state basis. The active ingredients on that are awareness, care, and research. Among the most important research questions, from my perspective, are the economic ones. How do you show a return on investment? How do you demonstrate efficacy of workplace policies, of national policies? What's the science for that implementation research? Because there are some sectors that are invested in menopause. Most are not. So the economic argument has to be paramount because they're not going to do it for the goodness of women. They're going to do it for the economics. So we need to build these partnerships and explore what are the best ways of delivering care in lower, middle, and higher income countries so that we can help people to get those returns on investment that the data that we're hearing about suggest.
Yeah, I think if you look at the numbers, 20% of OB-GYNs are well trained on treating menopause, and only 20% of our women feel actually well informed about what's going on to their body. So the question is, how do we get these 20% up to, I don't know, 80 or 90% within a reasonable time frame? So I think that's the ask. I think what it requires is international collaboration. We have a higher proportion of women in industry nations suffering from menopause, but in absolute numbers, of course, LMICs are outnumbering by far. And we have to leverage cross-sectoral partnerships, something which went pretty well around the pandemic, to have the private sector, governments, other institutions collaborating on finding solutions. And then, of course, I think it's key to train physicians and caregivers. That's a must. I think that's probably also the first call to action when you talk to policymakers. And we also should highlight that there's some frontrunners. So the UK and Canada at least have brought forward some measures to improve the situation for women, especially working women. And that should be a good example for others to follow suit, adapted to the local systems, requirements, and that's what we will call for as a company. And finally, it's inclusion of technologies into the healthcare system, be they new, be they existent. The guiding principle always should be they should be evidence-based, because a lot of women experiment with stuff that is not experiment-based because no one knows.
Yeah. As I'm listening to you all speak, and especially just now, a couple of things stand out. One is that, and I think, Jennifer, it was you who mentioned this, when we think about aging policy, you know, at the global level, the landmark frameworks on aging, whether that's MIPA, the Madrid International Policy on Aging, or you know, others, menopause is completely invisible from them, and yet, of course, it's inseparable from the question of aging, right? Similarly, when it comes to things like ICPD and policies around family planning and reproductive health care, as you said, surveys and any kind of attention goes up until the age of, reproductive productivity, and then it's as if reproductive health no longer exists for women who are older than 49 years old. And so, and this is all happening at a time when people are living longer than ever before across the globe in high, middle, and low income countries, and where, especially in the global south, there is a focus on the youth population, but a complete negligence when it comes to older populations. And so we're just about out of time, but I have just one last question that I wanted to ask all of you, and please keep your responses brief, if you will, which is, what needs to change for a life course approach to be taken when it comes to menopause? Because that really seems to be what's missing in many ways. And Pauline, you're nodding your head, so maybe I'll let you take that one.
Menopause care is primary care. Menopause care is primary care because all women go through it. So it needs to be integrated into medical care through expectations that it affects half the population, and there are estrogen receptors in every bodily system, from your eyes to your lungs to your liver to your bones, and it's preventative care. What we do for ourselves at midlife is an opportunity to optimize our health for the rest of our life. So I think that lifespan perspective and the idea that it should be natural because it's part of the aging process is a really important one.
Yeah. Thank you for that. I know we're out of time, but I felt that was a really important question to ask. And for our part at FP Analytics, it's also how we're approaching our research agenda. And so actually, as I mentioned, we have a new report out today on the impacts of menopause. And just a few weeks ago, last month, we launched a report on family planning for a prosperous future, and again, taking that health and economic lens, and in partnership with Bayer. So thank you to all of you for participating in this conversation, supporting the research, and really bringing this topic to the forefront of the agenda when it's been off the agenda for so long. Thank you.
Thank you.